Um, Thanks everyone for being here today for this webinar presented by Behavioral Economics in Action at Rotman in partnership with the Behavioral Science and Policy Association. This is our 5th webinar of this academic year. My name is Laura Goodyear. I'm a first-year PhD student in marketing at Rotman, a BEAR research coordinator, and the moderator for today's webinar. Behavioral Economics in Action at Rotman, or BEAR, is a research center at the University of Toronto's Rotman School of Management, whose 3 programmatic missions are to research, educate, and engage in meaningful outreach with our academic, governmental, and industry partners. These monthly webinars are our way to hear firsthand from academics and practitioners who are making meaningful impact in the world of behavioral insights, in particular, behaviorally informed business and evidence-based public policy. We are delighted today to have Julian House, a scientist from Ontario's government's Behavioural Insights Unit, presenting behavioral insights into student vaccination. But before I introduce Julian, I would like to go over the ground rules for this webinar. Following this introduction, our speaker will deliver a 35-minute presentation. During the presentation, please submit questions for our speaker by clicking the chat tab at the top right of your WebEx screen and typing it into the entry box. These questions will be visible to all participants. At the end of the talk, and with time permitting, we will have a question and answer session in which I will select questions from the chat tab to ask our speaker. Without further ado, I'd like to introduce Julian House. Julian is a scientist with the Ontario Government Behavioural Insights Unit. He also teaches behavioural economics and marketing at the University of Toronto's Rotman School of Management, where he is a research fellow. His research into how behavioural science can be applied to advance public policy and social welfare aims to appear in top academic journals, including the Proceedings of the National Academy of Sciences and the Behavioural Science and Public Policy Journal. Thank you, Julian, for being here today, and take it away.
Thanks, Laura, for that kind introduction, and thanks to BEAR and BSBA for inviting me to speak with everyone today. We're not perfectly set up for voice over IP in my office, so if there are any troubles with my microphone levels, please let Laura or Liz know over the chat, and I'll try to make adjustments over here if you have any trouble hearing me. But otherwise, I'll assume that you can hear me, and I'd like to start by introducing actually my team really quickly. Let's see if I can share my screen. And I think now people should be able to see a couple of headshots of the team that I'm a part of here in the provincial government. We are a team of now 7 with a co-op student who has started with us a couple of weeks ago, and she's with us until the end of the semester. So it's been great to have Sarah on board, but we're a small team, and what that means is that we serve as kind of...
Just a second, we can't see your screen just yet.
How about that? Does that work?
Great, yep, we can see it.
Perfect. Forgive the technological mishap. I'm a little bit new to WebEx, as well as I'm sure some of the audience. So we serve as a kind of internal consultancy to the public sector, both within the province and across other levels of government. We've worked with the federal government and municipalities in Ontario that are delivering public services that improve the lives of Ontarians. And the way we do that with such a small team is always through collaborative partnerships. And we are, therefore, if anything, enablers of behavioral science within the broader public sector here in Ontario. And in the spirit of that, today, rather than providing a kind of finished product presentation that I think tends to be the things that you would see in other presentations at conferences, or maybe even in this webinar series, I thought I'd present 2 works in progress because the hope is that they're not so finished and polished that they kind of hide the process of actually ending up with what are some pretty good results, but instead help kind of pull back the curtains, show a little bit about how the sausage is made, so to speak, and hopefully therefore demystify and enable the folks who have taken time out of their day to be a part of this webinar today to see how they could actually go about applying behavioral science to their own work. So, trying to make it easier for folks to take the kind of techniques and approaches that we do and apply them. So the first work in process that I want to share, both hopefully on my screen now and that you can see, and as well over email. I think Liz Kang, who's one of the research coordinators at Bear, is going to be disseminating our workbook over email. So I'm hoping that by sharing this prototype of our workbook, it's not finalized, people can get a sense of how it is we work, and also get some support if you're interested in applying behavioral science in your own work. So the workbook that we've put together, I'll just give you a quick leaf through of it, actually walks people through the 4-stage approach that we take to problem solving in our unit, and that indeed was first kind of published by Data and Mullainathan in a 2014 article, and has been since picked up by a number of behavioral design and behavioral insight groups around the world. And it's framed around what we call the test approach. So target, explore, solution, trial. There's a chapter on each, and I'll leave you to kind of peruse them. But I just wanted to give you a sense that the idea of this workbook is not intended to be kind of a high-level abstract document talking about the principles and theory and just case studies, but instead actually giving a series of kind of exercises that we use in collaboration with our partners, and that you can do kind of in the comfort of your own offices to try to identify good opportunities in the target section, and then prioritize them using what we call the MIST criteria, and then go through the explore stage in the next chapter to think about how the context surrounding the decision that you're interested in may be influencing people's decision making, may be causing barriers to their optimal decision making, may also offer some psychological and social levers that you could potentially implement. So kind of the actual process of what does mapping something out look like if you haven't done that before. We have a chapter on the solutions. So, helping you to ideate using the behavioral science theories, what kinds of low to no cost interventions may be helpful for motivating the particular behavior that you've targeted and explored in the previous chapters. And then, helping you also to think about what kind of evaluation framework you're going to use to test these ideas to determine whether or not they have the beneficial effects that you were hoping for. So it's, we think, a really great resource, and it's intended to, be read. So I won't go on talking about it. But you now have a copy, or should do shortly, in your inboxes, and we sent 2 versions. The Word document is accessible if that's needed for you, and then the PDF is a slightly more colorful version. And the case study that I want to talk to you about today, that Laura introduced as kind of the topic of today's webinar, hopefully will kind of bring that series of exercises in the workbook to life and show you, again, what the actual process of identifying and exploring and then problem solving and testing these kinds of behavioral challenges looks like. And as I promised, this is actually a work in progress still. As it says kind of on the title screen here, it's a multi-year pilot project that we started back in 2017 and now are wrapping up the second phase. And it's an exciting project, and hopefully it'll illustrate the value of iterating on these complex policy and public program challenges. And I would also be remiss if I didn't say, a great thanks to our partners at Toronto Public Health, who have been so fantastic in making this possible and have, really been, I think, visionary in thinking about how behavioral science can make the lives of the citizens that they serve through this program better. Because one of the many portfolios under Toronto Public Health purview is the protection of approximately 350,000 students in over 850 schools from vaccine-preventable diseases. So, children going to these public institutions where they're in constant contact with each other pose potential infectious disease risk to one another. Vaccines are one of the most effective, if not the most effective, public health intervention ever created. But of course, they're only effective if people actually have their vaccines. And for some people who, for reasons due to their health or other kind of philosophical reasons, who can't get the vaccines, they can still get protection if we have enough herd immunity in our school populations. And so, trying to get to that 90+% of students being immunized in school is a really important public policy challenge. And it's one that puts a lot of strain on the limited resources that Toronto Public Health has to deploy. With such a large population, it's not easy for Toronto Public Health to keep tabs on all of the immunization records that parents are required under law to submit to their public health unit, so that in an event of an outbreak, they can reach out to those students who are potentially at risk and let them know that they should be staying home to be safe. And to make this process easier, to lighten the demand on the limited resources that Toronto Public Health has, one of the things that was done recently was the creation of a new online reporting tool that parents could use to report their vaccines to the public health unit without kind of the typical paper trail of faxes or mailing or even calling in person and all of the labor processes that are involved in that. So this project, first and foremost, wanted to focus on shifting vaccine reporting by parents online, so we could free up more resources to help students who were at greatest risk of not being immunized. And that's what we're going to do in the second wave of the project. But first, I'll talk to you about our first wave, where we were really focusing on increasing self-service using this online tool for parents who can report their vaccines easily. And this is kind of the overview of that test approach that I mentioned is explained in greater detail in the workbook, with the addition of this scale component at the end, where if the trial reveals that there's one solution which is leading to improved outcomes, you can then scale up, and that's indeed what Toronto Public Health has done for 2018 and onwards. This is an example of the exploratory phase that we did in this particular project. It's a very detailed behavioral map where we tried to put down all of the information that we obtained through kind of interviews and discussions and observations of the existing program. And that revealed a lot of barriers that you can see highlighted there with the red exclamation marks, some sentiments from the end users. And this really helped inform the solutions that I'll explain in just a second. Some of those solutions were things that we were able to fully evaluate, and some of those solutions are more kind of taking care of small links in the chain, or what Professor Dilip Soman from the Rotman School in his book The Last Mile refers to as cleaning the pipes, where you have to make sure that the entire process for someone's outcomes are made as easy as possible. And so, one of those things that we did in that kind of cleaning the pipes process was, for example, create an easy-to-remember URL that we could share with parents that would take them directly to the online tool where they would be reporting, rather than directing parents to the main Toronto Public Health webpage and then asking them to navigate themselves to the service. Taking them directly to the page where the button was designed to be in a visual hotspot so they could easily see it. Other things that we did in this vein were make some changes to the online reporting tool itself, a little bit of personalization, again, a little bit of making key tasks more salient, so moving that button for submitting immunizations up in the scrolling kind of window. And finally, one of the things that we were trying to do was reduce overall call volumes to Toronto Public Health. So taking the email receipt that you got afterwards and making it clearer so that parents understood exactly kind of what to expect over the coming days, and were less likely, hopefully, to pick up the phone and say, I just submitted these vaccine records online. Did you get them? But the really interesting part of this trial, hopefully you'll agree, is when we sat down to design solutions related to the recall reminder letters. So these are letters that have been shown in earlier academic research to improve vaccination rates by letting people know, hey, your vaccine records are out of date. And the status quo or control in our trial letter looked like that up on the screen now. It's a 2-page front and back letter, quite dense with information. And a couple of things that I want to point out are the URL to the Toronto Public Health immunization website was already on the letter. This isn't the new customized URL that we created that took you directly to the service. But anyway, we're informing people on this letter that you can go to report your vaccines online, but it's kind of buried there on the second page. And instead, on the front, you've got something that looks a lot like a form that the doctor should be filling out. And once you've got a form, people start to assume that this form has to be, perhaps faxed in or mailed in to the public health unit. And indeed, a lot of these letters were coming back via fax and mail. So that was something that we thought needed to be changed. And another thing, among others, was you can see up in the top right corner of the page, there are actually two different IDs that people are given, one of which works for the online service, one of which you're supposed to use when you call in. Two IDs, obviously very confusing to parents when they're receiving this letter, and obviously quite, you know, upset about the fact that they're getting negative information about their students' health. So how do we maybe make this letter a little bit easier to understand? Well, after a lot of iterations and working with Toronto Public Health, here's what we refer to as the online salience version of the letter. You know, taking advantage of formatting, some contrast, and although it's black and white, you know, graying in sections to highlight important information to try to get people's attention to that important information. Trying to give people concrete deadlines by when they needed to report the information, and trying to make everything as clear as possible. Another thing that we tried in another solution, so there are two different versions of the letter that we tested, is adding a social norm statement. So 9 out of 10 high school students get the vaccines needed to go to school. Have you? Which in previous research has been shown to be effective at helping people regress to the mean and align their behavior with that social norm. And on the back of both of those letters, we had the same kind of visual information that was trying to walk people through the steps that they would have to take to submit their immunizations online. And that was the main intervention that we developed for this project. At the same time, however, Toronto Public Health had developed in partnership with their communications department some what you might call inserts, or I've heard them referred to as stuffers, these kind of postcards that would go into the envelope together with that letter. And we, you know, thought that this was an interesting and obviously, you know, colorful way to try to get the same or similar message across. And so what we did is we tried to incorporate this into the trial that we constructed so we could evaluate both in a kind of side-by-side comparison to see which of these different interventions would lead to the most uptake of the online service. And the way we did that is through a fully crossed, randomized controlled trial. There's a lot of detail on this slide. I'm happy to go through this maybe in the question period if people have some clarifications that they'd like. But what is important to note here is that we were able to isolate the impact of the 3 different letters we were trying from the postcards as well. So what we found in our evaluation is shown here, that we saw a really dramatic uptake in the use of the online service. So in terms of likelihood ratios, we're talking about tripling the likelihood that someone is going to use the online channel to report their vaccine information. And this can really potentially help to free up resources at Toronto Public Health, which is really exciting. Importantly, we wanted to track some other important variables to ensure that you know, the new interventions weren't having any deleterious effects on things like exemptions, which we did not find, or the likelihood of students being suspended. So one thing that I don't think I made clear at the beginning of this presentation is that under the legislation, students who don't have up-to-date vaccine records are actually suspended from school. So our ultimate kind of outcome on this graph on the right-hand side of the slide is the number of students who actually receive a suspension from school because their vaccine records aren't up to date. And you're seeing that although there's a slight difference, it's not statistically significant, especially for our green intervention there, the online salience letter. So I'll skip by some of the more complicated findings. I'll just stop on slide 25 and note that in contrast to those letters that we designed, those postcard inserts that I discussed earlier actually didn't have any statistical effects on online uptake, even though they specifically mentioned the online service, nor kind of the rate of suspension or exemptions. So one of the things that I mentioned that's really exciting about this project, and which I'll try to kind of cover in the time that we have remaining, is the iterative nature of this. So, 2017, 2018, we did see a significant change in behavior in terms of online reporting. And so now the question was, well, could we make further improvements? Is there any way that we could potentially redeploy that now capacity that we created in Toronto Public Health to actually do the more important, or to achieve the more important goal of getting the coverage rates for vaccines higher, or in the inverse, a reduction in the number of students who are suspended from school because of their out-of-date vaccine records. So, looping back to the beginning of the test approach, one of the solutions that occurred to us after doing some deeper data analysis of the previous 2017-2018 trial was there's a particular vaccine that leads to a significantly higher likelihood of suspensions from school. So Canada is one of the few jurisdictions where the meningococcal vaccine for strains ACYW 135 is required for attendance at school. Most jurisdictions only require vaccines against meningococcal strain C. And that means that a lot of folks who may be coming here as new Canadians are less likely to have had this vaccine if they come here after grade 7. If you're a student in grade 7, you get the vaccine in school during in-school immunization clinics. But suppose you were sick on that day, suppose your parents took you out of school for some reason for that day that the clinic was held, you also might not have this vaccine. And importantly, for complicated reasons that I'm not still fully clear on, physicians or family doctors, primary care physicians, are unlikely to have the ACYW 135 meningococcal vaccine strain stocked in their offices. They have to order it from a different public pharmacy than all of the other vaccines that are required for school attendance. And as a result, they are just less likely to carry it. And that means that typically, if a student doesn't get this vaccine at school, the easiest way for them to get it is at a clinic offered to them by Toronto Public Health. So these clinics are offered for free around the city, but importantly, this is a new process for most students. Most students, they figure, I either get a vaccine from my family doctor or pediatrician or at school. I've never heard of these clinics before, and you can see kind of the dramatic result here. So students that are not missing Menactra, which is the brand name version of the ACYW 135 vaccine, are just much less likely to get suspended than those who are missing Menactra. We figure that's because Menactra is just harder to get. So again, we did some behavioral mapping. I kind of explained the difficulties and barriers that are highlighted on this map already. And that led us to the conclusion that what these students who are at much higher risk of getting suspended from school because they need this difficult to get vaccine, the hypothesis that we drew from this was that perhaps helping them navigate this complex system would be beneficial. And so what we've designed in the 2018-2019 version of our project with Toronto Public Health is a slightly different variant that only is sent to those students who show in their records that they need the ACYW 135 vaccine. And you'll see here that this letter actually now starts to place emphasis on calling Toronto Public Health. So not going online, but instead having a healthcare professional explain the complicated process to you. And then also on the back of the letter, you can see maps and dates for when the next clinics offering this vaccine are offered. So this is a little bit more structured help, encouraging people to call. So we've freed up capacity at the Toronto Public Health Information Center now, with more people submitting their easy-to-report vaccines online. And the hope is that we're now directing only those students who are at greatest risk to actually call the information center. And the other thing that I'll just point out is down at the bottom, you can see this My Appointment gray box down here. This is a traditional planning prompt, which has been shown to be effective with things like encouraging people to get colonoscopies, helping them make a plan of where and when they're going to actually get the vaccine for their child. The other thing that we did is a little bit less radical in some ways, but we think likely to have an impact. We looked at the fact in our data that there's a lot of variance in terms of the likelihood of students being suspended between schools. That is, some schools are really appear to be really good at making sure their students' vaccines are up to date, and some other schools are less so. And one of the things that we thought is that the school administrators may be playing a more or less interventionist role in regards to the vaccination of their students. We conducted a number of interviews with these top performing schools and found that indeed they were conducting a kind of systematic outreach campaign to their students. But one of the things that they said was that they didn't have enough time to do this, or they would like more time, because although Toronto Public Health lets them know which students are up for suspension, they only do so a few weeks before the actual suspensions come into effect. So it's kind of a last minute, hey, these are the students who are going to be suspended 2 weeks from now. And what we simply did was move this information forward in time so that school administrators would now have about 2 months to actually intervene with their students. And we also designed an email that would hopefully make it really easy for very busy school administrators to act on this information. You can see another thing we did is we let schools know how they compared to other schools in Toronto in terms of the number of their students being suspended due to out-of-date vaccine records. So a little bit of social norming. And we, again, trying to make it as easy as possible, kind of pre-wrote a message that they could send to their students, helping explain to the students how to get vaccinated, what they need to do, how to report their vaccines, etc. So that hopefully the school administrator would be the messenger for this information, and rather than a public health organization that the student and or their parents are unfamiliar with, a friendly face in the form of the principal or the school secretary, etc., could be the person reaching out, conveying this information, which we know from previous research can be quite important. The messenger is often as important as the actual message being delivered. I won't dwell too much on the actual structure of this trial. Again, I think that's something we can cover in the Q&A if people are really interested in the structure of either the 2017-2018 trial or the 2018-2019. And I think I'm at about time, so I'll just pause here to say thank you everybody for your attention and staying with me so far in the presentation, and I look forward to any questions you might have about either the workbook or this case study.
Great, thanks, Julian. Really interesting stuff. So we'll start with a couple questions. I personally have a question for you. I was curious which was more successful. Was it the intervention with the parents or with the schools that you saw sort of more uptake, more reporting?
Right. Great question, and my fault for not being clear on this. As of yet, we're still waiting for the data to come back on the 2018-2019 trial. So all of the letters have gone out both to the schools and to the parents, and we're just waiting for essentially the end of the program to finish, which is in April sometime, in terms of all of the suspensions to finish, and then we'll actually crunch the numbers and see. But we do have a little bit of anecdotal feedback. So one of my colleagues, Kira, for example, has a daughter in high school whose friend actually received a message from her principal about getting her vaccines up to date. So we thought that was potentially the workings of the message that we sent out to half of the schools. And the other kind of anecdotal information that we've been getting is keeping track of attendance at Toronto Public Health clinics, and those clinics are fully booked every week so far, and the majority of, or the overwhelming majority of vaccines that are being given are the ones for the meningococcal ACYW135 strain, which is really important because, again, there's only so much space at these clinics, and they'll give you any vaccine that you are eligible for under the vaccination schedule, but we really want to be giving that limited space to people who need that vaccine that's difficult to get from your family doctors. Whereas, if you need the flu shot, or if you need, meningococcal C or the varicella chickenpox vaccine, we'd rather kids go to their family doctors, where it'll be a less of a wait for them, and more appointments to go around for people who need it. So stay tuned.
Great, yeah, we're excited to hear the results. Another question. In terms of the letter that was sent with the social norm and without the social norm, I noticed in the results that there didn't seem to be much of a difference when the social norm was added to the letter. I was wondering if you had any insights into why you think that might be.
So I think this is an interesting question, and there's a number of instances out there where when the Behavioral Insights team tried a social norm message around organ donor registration, when some Harvard scholars tried it with pension enrollment, where we've seen social norms not be effective or in some cases even backfire. I don't think we have a full understanding of why it is such an effective intervention in some instances and not in others. Obviously, I still, or my team and I still think that it's a valuable intervention, or we wouldn't have put it into the emails that go to the schools. But I think, looking back at it, it's probably that it was a little bit mistargeted for the particular outcome that we were measuring here, which was online behavior. So the social norm was really targeted towards vaccination and vaccine reporting. And so I guess it's not surprising that it didn't have an effect on the online uptake because it wasn't specifically about that.
Okay, that's really interesting. We have a question from one of our attendees. They ask, have you shared this data with other areas struggling with vaccination rates?
Yeah, so Toronto Public Health has been great, not only in their willingness to try new approaches and partner with us to make this exciting research possible, but also in their enthusiasm for sharing the results, which is, at the end of the day, one of the reasons why doing these kinds of rigorous evaluations is so important. It's important for the organization itself to be able to know what's working and not, but also to allow for the dissemination and hopefully acceleration in the spreading of innovation from one organization to another, because the methods, the data, all of that is sufficiently transparent that other people can evaluate for themselves whether they think it's a worthwhile intervention to apply to their own scenario. So we've been at some presentations to larger public health bodies within Ontario, and I know Toronto Public Health has actually been making the rounds with this data to pan-Canadian public health conferences. And we're aware of at least one other municipality here in Ontario that's looking to roll out these letters in, I think, August or September.
Great, thanks. So this concludes the Q&A section. I'd just like to say thank you to everyone who asked questions and participated in today's webinar, and thank you again to Julian for the wonderful presentation. Full recording of this webinar will be available at our website by clicking on the side tab labeled Events and then clicking the sub-tab labeled Their Webinar Series. Our next webinar will be Thursday, February 21st at 12 p.m. and we will hear from Dr. Tanjim Hossain from the Marketing Department here at the University of Toronto and one of VAER's chief scientists. Thank you all again for attending, and you can exit this webinar by closing your WebEx screen.